If you're watching this video, it's likely that your family veterinarian has made the diagnosis of a ruptured or an insufficient cranial cruciate ligament, or ACL, anterior cruciate ligament, as it's known in human beings. Essentially, this is one of the many ligaments within your dog's knee that is no longer working appropriately. The dog's knee is an exact miniature replica of the human knee. It has all of the same ligaments, all of the same parts, and within the knee are two ligaments which cross one another. They form a cross, hence the term cruciate or crucifix or Santa Cruz. This is where this word comes from. These ligaments form a cross, and one of those ligaments has torn or become insufficient. This is a common athletic injury in human beings, or another way of thinking about it is an injury that human beings get when they are in a knee flexed position, or they are performing a sports related activity in which their knee is flexed. In dogs, of course, they are always in a knee flexed position, mostly because they are terrestrial quadrupeds, which means that all four of their appendages are actually on the ground. So they walk in such a way that their knee is always flexed. This, of course, is a predisposing conformation to the injury itself. In other words, dogs walk with their hip flexed, their knee flexed, and their ankle up off the ground. Mother Nature has built them in such a way that they are very much like a coiled spring, or like a sprinter in a block. If you can remember back from the Olympics, they coil themselves in such a way that they can burst onto the scene. Dogs, of course, are built that way because in the wild they have to actually be able to catch their breakfast and their dinner. They don't get to wander up to a bowl of carbohydrates twice a day. So that's why they're built that way, but that conformation, very unique, is also a predisposing factor in the injury in dogs. The surgery itself actually does not replace the ligament, which is a difference between the human repair and the canine repair. In humans, we actually replace the ligament. We replace it with a piece of ligament taken from an individual's own body from somewhere else, or from a cadaver, or as a prosthetic ligament or a man-made object. But in the dog or in the canine, we actually don't replace the ligament. We actually cut the tibia, which is the shin bone. We cut it, that's the bone below the knee, and we cut that and we make an alteration in the slope or the surface of the tibia. It's just a few millimeters of movement, but that few millimeters of movement allows another one of the many ligaments within the knee, notably the straight patellar ligament, to take over for the function of the one that's torn. So in fact, we actually don't replace the ligament. We replace the function of the ligament with the TPLO surgery. Once your pet fully recovers from this surgery, which is an approximately 4 to 6 month recovery time, you should expect near complete return to pre-injury status. Whatever your pet used to do prior to surgery, you should expect your dog to be able to do, whether or not that's running, keeping up with the other dogs in your house, chasing balls, frisbees, or swimming. Most dogs are going to be able to return to that level of activity with few to no limitations. In fact, most dogs will live their entire life with few to limited setbacks as a result of having had this injury. Probably the most common side effect, or the collateral problem associated with this particular problem, is that 30 to 40% of dogs will, within 2 years of one side tearing, will have their other side tear. We like to spend a little bit of time and just give people a little idea of what the day of surgery looks like. Your pet should be dropped off in the morning, preferably before 9 o'clock, without having eaten anything since 10 p.m. the night before. Water's okay up until surgery. If your pet has any special medications, those medications, for instance, that need to be purchased at an outside pharmacy, or any special dietary issues, special foods, whether or not those are homemade foods or not, we ask that you bring those with you so that your pet will have those things available to it while he or she is in the hospital. So surgically, what we do is the entire leg will be shaved. It will be shaved all the way from the ankle, which is the hock in the dog, all the way up to midline, or just above the tail. The dog will be x-rayed under anesthesia, and a 4 to 5 inch incision or surgical incision will be made on the inside of the leg. What I do surgically is I inspect the joint, all of the ligaments. I clean out any abnormal pathology, which includes torn ligament, torn meniscus, which is a small piece of cartilage within the joint that commonly does tear at the same time, as well as any osteophytes, which are bone spurs that may be in the way of future performance of the knee. After that's done, we completely close that surgical incision, and then we make our bone cut. After the bone cut is made, a bone plate is applied, which is a stainless steel, medical grade stainless steel bone plate with six to eight screws in it. Nearly all dogs are going to go home the day after surgery. We usually discharge dogs between 2 and 5 o'clock the day after surgery, mostly as a means of assessing whether or not they have an appetite, whether or not we're able to give them their medications, and how comfortable they are on oral pain relievers as opposed to injectable pain relievers. Most dogs, once they get home, are going to spend a day or two acclimating to their new confined area, which should be an area of about 10 feet by 10 feet, and within 4 to 5 days, most dogs are going to be acting more like themselves. Medications are given for the first 5 to 14 days after surgery, depending on individual patient factors, including and not limited to antibiotics, pain relievers, anti-inflammatories, and in some cases tranquilizers will be necessary to help enforce the restricted activities that are required for the successful post-op rehabilitation of this surgery. I do think this is a good time to spend a few minutes just discussing what house arrest really means, and that is what most dogs are going to need to fully rehabilitate from the surgery. It's a period of 6 weeks where their area is confined to approximately 10 by 10 pen or small bathroom or laundry room when you're not at home to supervise the activities. There should be, during this period of time, no roughhousing, no playing with other dogs, frisbees, toys, or children during this time. All periods of outside activity, including urination and defecation, should be chaperoned, and your pet should be on a leash. I think wrongly, at certain times, I do give the impression to people that their pet's not allowed to do anything during the first 6 weeks. That's actually not true. Your dog has to use the leg, but in a controlled, non-explosive manner for it to heal properly. We're simply giving the tissues or the ligaments and the joint capsule and the muscles in and around the knee time to recuperate from the surgical procedure itself. Sutures are removed at approximately 10 to 14 days post-operatively, and then 4 weeks after that, which is 6 weeks post-operatively, a set of x-rays will be taken. It's kind of like a report card for your dog. The importance of this is to measure the amount of healing so that we can, with a little bit of luck, increase the amount of exercise your pet is allowed to do. At that point, we usually schedule one more recheck approximately 4 weeks later to completely document that the surgical site has healed before we are able to fully allow your pet to return to pre-injury status. Most pets require a period of 12 to 16 weeks of post-op exercise restriction before they're able to return to all of their pre-injury activities. I think it's important to have a brief discussion on some of the uncommon, albeit even sometimes rare, complications that we may see with the TPLO procedure. Any surgical procedure or medical procedure for that matter has a short list of potential complications, including anesthesia, which is always a concern for many people, except to say that in today's contemporary times, our veterinarians, including myself, use protocols that are very similar to those that would be used for you if you were to go into a procedure at a hospital. Additionally, there's some concern over infection. That is something we very rarely see also. We use sterile technique, and if a trained surgeon is doing the surgery and surgical time is minimized, less than approximately 90 minutes, the chance of a infection in a routine orthopedic like this is very low. We also do usually send home antibiotics with most of our patients. And finally, I think what I like to do is just highlight where I see most of the complications with the surgery. And frankly, it's not in anything that we can very easily control in some circumstances. It's that the dogs feel in many cases, too good too soon after surgery, and they tend to overdo it. In most cases, this is just a simple matter of a little bit more rest. In very, very rare circumstances, catastrophic failure of the surgery is a potential. We do recognize that this is a big commitment for you, your family, and your pet. We also would like to tell you that we will be with you every step of the way, and the results we have found to be well worth it.